Well, good afternoon. I'd like to welcome you to our seminar today, From Brushing to Beyond, Essential Dental Care for Older Adults. I'm Dr. James Castle. I am a dentist and an oral and maxillofacial pathologist in the Division of Oral and Maxillofacial Pathology at Johns Hopkins Hospital. Tony, I'm not, there we go. And here is a nice photo of Johns Hopkins. I really enjoy Johns Hopkins as it is a wonderful place to work. My colleagues are fantastic in the Department of Dermatopathology, and really great people work here. I work in the Blaylock building over here, if you can see my cursor, and really enjoy Johns Hopkins as it is a fine institution to receive care and to also work. So, what are we talking about when we talk about oral health and older adults and how it pertains to aging well? According to the World Health Organization, who says healthy aging is an important goal and a big key to turn population aging from a challenge to an opportunity. Uh, Good oral care helps people to eat properly, speak, and socialize without pain or embarrassment, and contributes immensely to their quality of life and general health. Older adults, unfortunately, are not regular users of dental services for a myriad of reasons, and they may experience significant barriers to receiving necessary dental care. Overall, as a group, the elderly suffer disproportionately from oral tissues and from lack of access to oral health care. The oral health of the elderly becomes potentially more complicated as they become frail, homebound, or possibly even institutionalized. These older adults may be unwilling or unable to receive routine care, and that puts them at a greater risk for general and oral complications. So, overall, we believe that there are many benefits uh, to the overall well being of an older adult based on their oral health status. By that, I mean physical, mental, and social well being is enhanced. Life activities like eating, speaking, and social interaction are improved. Healthy aging helps maintain older adults' ability to adopt a more healthy lifestyle that allows them to attend regular oral and general health care, able to maintain good oral hygiene, and also to have an adequate nutritional intake and possibly even good physical exercise to reduce the risk of age related diseases and disabilities. Healthy and independent older adults also have less demand for long term care or support from their family members or caregivers. Living longer, which adults are doing nowadays, means that they may spend a longer amount of time with their families, including especially their grandchildren. And as a grandfather myself, I do appreciate that interaction, and I am looking very much forward to spending a lot of time with my grandchildren. Those grandparent grandchild relationships are both positive influences on the lives of both generations and for overall family well being and bonding. Healthy, independent oral adults also have less demand for long term care or support from their family members or caregivers. They also mean that we can do much better regarding family bonding. So, why does it all matter? There's a positive association between periodontal disease, coronary heart disease, atherosclerosis, and heart failure. Emerging evidence also indicates that suboptimal oral health, such as gingivitis, dental caries, and tooth loss, is associated with an increased risk of developing cognitive impairment. Very, very important to stress that fact. Older adults with edentulosum, meaning loss of teeth, showed an increased risk of having depression. Another example of why good oral health matters. What are prevalent dental conditions that are prominent in older adults? Obviously, untreated tooth decay is a big problem. One in five age 65 or older have untreated tooth decay. 20% is quite a large number in the American population, given the fact that we have such great health care in this country. Gum disease, gingivitis, periodontitis, is seen in about 68% of adults age 65 or older. Tooth loss is seen in 20% of adults age 65 or older. Those patients have lost all of their teeth, but it's more prevalent among adults age 75 and older compared to those 65 to 74, almost double the total number. So, what are some of the other prevalent dental conditions? Well, uh, older adults age 65 or older suffer from periodontal disease. We can have reduced chewing ability, which limits older adults' food choices, affects their nutritional intake, and therefore their enjoyment of food, because both the teeth and the periodontium, meaning the supporting structures of the teeth, need to be maintained. Of course, oral cancer is something that can become more prominent in older adults. Oral and pharyngeal cases are primarily diagnosed in older adults, with the median age at diagnosis being at 62 years of age. Screening exams need to be accomplished during routine dental care at every single visit. So, where do we start? Well, we start with a good dental care professional, such as myself. As you can see here, I did 30 years in the Navy as a dentist and an oral and maxillofacial pathologist before coming to Johns Hopkins. So here I am treating a soldier while deployed in Kuwait, and obviously, even in a hostile environment, a wartime environment, good dental care is important to keep our soldiers, sailors, and Marines on the battlefield and in good condition. How does a cavity develop? Well, uh, bacteria in the oral cavity, which we have normal oral flora, breaks down food into acids that erode through the enamel of the teeth. So, obviously, if we have more food that the bacteria likes, meaning sugars, there's going to be more acid that erodes the enamel and leads to dental decay. What is the basic tooth structure that we see that caries does affect? The outer portion of the tooth, which is most visible to us in the oral cavity, the tooth is covered with enamel. That's a hard structure that, generally speaking, is permeable, but also provides a good barrier to uh, oral acids. Beneath that is the dentin, which supports the enamel and surrounds the nerve of the tooth, also known as the pulp. The dentin has small little tubules that have fluid that flows back and forth. And when exposed, that's why you get a sensation with hot and cold foods, because that fluid is moving back and forth to the pulp of the tooth, creating a painful sensation. Caries progression can happen at any portion of the tooth. Most likely, it occurs in the pits and grooves of your molars and premolars and can get to be quite large once it crosses the line here known as the dentino-enamel junction, and it can blow through the dentin pretty quick and get to the nerve of the tooth and cause a painful sensation known as pulpitis and lead to possibly a root canal in that case. Obviously, we know that you can get caries in between the teeth as well, those smooth surfaces. So that's why we encourage flossing on a daily basis. What are the basics regarding brushing? We'll go over that here quickly. The main thing that you need to entertain is using a soft bristled toothbrush. I can't stress this enough, because I know that if you use a hard or medium type tooth bristle, it feels better because it seems like you're scrubbing things off your teeth a lot better. But a soft bristle toothbrush is what is needed because if we use a hard or medium type bristle, it can lead to something called toothbrush abrasion. And that's exactly what's happening. You are abrading not only the gum tissue around your tooth and exposing the root area, causing a V-like notch called toothbrush abrasion. These areas are very hard for your dentist to restore and to allow for a restoration to be placed and maintained in that area. All of this exposed dentin leads to hot and cold sensations, painful sensations with cold drinks, ice cream, things like that. Coffee is going to be problematic as well. So, gentle toothbrushing with a soft toothbrush is what's necessary. What do you use on your toothbrush? Any type of toothpaste that has stannous fluoride. Doesn't matter what the brand is, it's whatever your taste preference is. And also, if it has the ADA approved symbol, look for that with your um, uh, items as well. I'm sorry, I got ahead of myself here a little bit. Let me go back. So, what do we need to do for proper brushing? Apologize. We need to place the toothbrush at a 45-degree angle along the gum line. You move the toothbrush back and forth in a very gentle motion, trying to tease the bristles underneath the gum line. Very, very gentle brushing, no scrubbing. We're not taking paint off a wall, just very gentle brushing in that area. We also need to do not only the front surfaces of the teeth, but also the back surfaces of the teeth as well. We use the tip of the toothbrush to brush behind the anterior teeth because that's a bit of a difficult process to go through and access that area. Also do it on the front teeth as well. And of course, we want to make sure we brush the chewing surface of each tooth, being very careful to get in those grooves and pits because those are where we do have foodstuffs packed in those areas and they like to uh, hang out there and cause tooth decay. Also, be sure to brush your tongue because your tongue does harbor leftover food products that will allow bacteria to grow. You can even get color changes on your tongue with different types of food and different types of bacteria that lead to a certain coloration. So make sure to brush your tongue every time you brush your teeth. Flossing. Although I personally have a hard time with flossing, it's not the most enjoyable thing. I know people avoid it, but it's probably the most important thing you can do. How do we floss properly? You need to pull 18 to 24 inches of dental floss from the dispenser. You wrap an end around your middle finger, each of your middle fingers, and then grasp it with your index finger and thumb. And now you have a nice taut piece of floss that you can work between your tooth. You hold the floss tightly and move it in a back and forth action to get it through the contact between the teeth. Some are harder than others based on how tight your teeth contact, but gently move it in a back and forth motion. And once it gets through that contact, move it up and down against the side of each tooth, being careful not to saw or cut your gums. You need to try to get a little bit below the level of your gums in that area, but be very gentle because you can do damage with floss and cut your gums in that area. So scrape each side of your tooth up and down inside that embrasure and clean that area. When you move to the next tooth, use a little new piece of floss. You kind of unravel around one of your middle fingers and wind it up with your other middle finger so that you get a new piece of floss ready to go for the next tooth. Now, I know some people have dexterity problems, so fortunately, they make a tool, a flosser. They have different names, different manufacturers, and basically, it is a piece of floss in a holder. Some are tighter than others, and you do the same thing. You work it in between the contact of your teeth and gently move it up and down. You need to use a couple of these for doing your whole mouth because one will get loaded with debris and just grab a new one. They're pretty cheap and they work really well. They really help with getting back to the molar teeth because of access sometimes is difficult and dexterity can be difficult in that area as well. Flossing around implants. The main thing, if you have implants, is do not use a flossing device that has any sort of metal in it because it will scratch the implant and lead to plaque retention. Just because you have an implant doesn't mean you're still you're alleviated from flossing in that area because you can get gingivitis in that area, and that will lead to periodontal disease and loss of the bone support for that implant. So, yes, you need to care for that implant as if you had a natural tooth in that area as well. So, what is periodontal disease? Periodontal disease is a chronic bacterial infection in the mouth that can occur at any age, but it seems like older adults are more prone to periodontal disease. It always starts with gingivitis. Gingivitis leads to red, swollen gums, and that's caused by the accumulation of plaque or a sticky accumulation of bacteria that tends to form around the neck or the collar of your tooth that's formed by the gingiva. That gingivitis can progress to periodontitis, lead to attachment loss of the gingiva, lead to loss of bone supporting the tooth, and lead to eventual loss of the tooth itself. What are the symptoms of periodontitis? Tender bleeding gums, painful chewing, teeth that are sensitive to cold or heat, any sort of receding gums that isn't related to toothbrush abrasion, but that will lead to periodontitis. Change in fit or comfort of partial dentures is important. That's important to note as well. Any type of tooth mobility is important to note, as that may be a symptom of periodontitis as well. Anything that leads to destruction of the supporting gums, tissues of the teeth is termed periodontitis, and it can progress over time, as I mentioned, to lead to uh, loss of teeth uh, through increased mobility, possibly infections, and extractions may be required in that case. The dentist or hygienist will examine your gums, and they may use a periodontal probe to check and measure for the distance of the pockets around your teeth. 2 to 3 millimeters is great, normal, average. Anything over that, we start to get concerned for periodontal disease, and we'll talk about different treatments surface discussion regarding treatment for periodontal disease. X-rays will be taken to evaluate for periodontal disease. As you can see in this X-ray here, around the premolars, we have normal bone height in between the teeth, kind of about the demarcation of the root of the tooth and where the enamel ends. And you can see here we kind of have this sloping and cupping bone loss around this molar. We've lost a significant amount of bone in this area. You can see a big piece of calculus right here on this molar that needs to be treated by the hygienist or the periodontist in that area. So yes, this patient will need to see a periodontist and have that treated as well. Here is the use of a periodontal probe. You can see those markings on it allow for the user, the dentist, or the hygienist to evaluate the measurements of the pockets around your teeth. As there is tooth attachment loss, you can see the probe goes farther down uh, the tooth pocket, and that can also be caused by swollen gums in that area, and also bone loss in that area can lead to increased probing depths. How do we treat periodontitis? Well, deep cleaning, i.e., scaling and root planing, is what's necessary initially, and in most cases of periodontitis. You may also be prescribed medications as part of your treatment, such rinses as chlorhexidine, other things to knock down the bacterial load within the oral cavity, that with minocycline or metronidazole. But remember that medication alone is insufficient for complete treatment of periodontitis, as mechanical treatment is also what's necessary. Given the level of your periodontitis, the dentist may recommend surgery that includes flap surgery, i.e., reflecting of the gums, to allow for better access and visualization of that area. You may also be treated with bone or tissue grafts that will help rectify your periodontitis. As you can see here in the flap surgery, your gums are reflected surgically, and access with this curette does clean up the root surface that wasn't able to be accessed with just a deep cleaning from the hygienist. And we get all that plaque and calculus and places that harbor bacteria on the root surface of the tooth. Here we are depicting Dries decalcified freeze dried bone allograft that's being placed in this area of bone loss to allow for the body to regenerate and incorporate that bone graft to allow for better support of that tooth. Something that's very crucial, very vital in cases of advanced periodontitis. All right. Some patients in this audience may have dentures. So let's talk a little bit about denture care. And we're talking about both full and partial dentures, as they both can accumulate plaque, stains, calculus in the same manner that the natural dentition does as well. So be aware of that. How do we take care of them? Number one, take them out at night. I know some patients are resistant to taking out their dentures at night, but that is an absolute must. Place that denture in water or a denture cleaner solution when it's not being worn, because it helps maintain its shape, remains pliable, keeps it from drying out. Dentures should never be placed in hot or boiling water because that can cause them to warp. Please keep that in mind. Denture adhesives are not a remedy for ill-fitting dentures. They may need to be relined or replaced to prevent oral sores from happening. You can see this patient here has an ulcer from an ill-fitting denture that is causing more pressure in that area, possibly sliding over that area. It's just an ill-fitting denture that needs to be uh, fixed or refabricated by your dentist. Other denture replacement considerations: if chronic irritation exists beneath the denture base, you can get an epilus fissuratum, oral ulcerations. You can have treatment resistant candida related to denture stomatitis. Um, if denture adhesives are required to eat or retain the dentures socially, the patient also will or cannot wear the removable prosthesis. That's when we should consider replacing the denture. The denture isn't stable in the mouth or no longer matches the other dentition, meaning there's a different coloration. The teeth are discolored, cracked, broken, missing. That's a good time to also consider replacement of that denture. If there's a change in teeth supporting a removable or partial denture or overdenture, we also need to consider replacement for that prosthesis as well. So what is an epulus fissuratum? It's also referred to as a denture epulus. You can see here we get a hyperplastic flap of tissue that's somewhat flabby over the gums because it causes irritation in that area, and we get some fibrous hyperplasia. You can see here we have a denture sore also caused at the flange of that ill-fitting denture. So that needs to be surgically treated, and that denture also needs to be replaced. You can see here again an epulus fissuratum that's caused by this ill-fitting lower denture, and it's poking out from the flange of the denture itself. Again, needs to be surgically removed, and that denture needs to be fabricated once again. Another example, you can get a inflammatory papillary hyperplasia, which as seen here, as these small little bumps in the oral cavity underneath the denture flange. It's a reactive tissue growth, and it's usually caused by not taking out the denture very often. It's asymptomatic. It does need to be removed, and it can be there for a long period of time. Um, Patients, again, need to remove the denture, as I mentioned, but they can also have an additional colonization with Candida. That's a normal oral fungus that is getting overblown within the oral cavity in some situations, and it needs to be addressed medically to be treated. And that's what's causing the red erythematous appearance in addition to the inflammatory papillary hyperplasia. So Candida, as I mentioned, is an overgrowth of normally occurring yeast within the denture and within the oral tissue themselves. Patients who are diabetics are especially susceptible, and it presents sometimes as a white plaque that can be wiped off within the oral cavity, but sometimes it appears as red erythematous gingiva, oral mucosa in this case, without that white appearance. How do we treat Candida? Uh, there is a um, antifungal troche. Basically, it's a sucker that you uh, dissolve in your mouth on your tongue 5 times a day for 14 days. You can also take an antifungal medication, fluconazole, or you can also apply clotrimazole cream if you have candidiasis at the corners of the mouth, which is known as angular cheilitis. Angular cheilitis happens in the areas of the corner of the mouth in some denture wearers because you have a loss of vertical dimension, meaning your chin is getting closer to your nose, and sometimes you can trap some saliva in the corners of your mouth, which would lead to an increase in the uh, uh, finding of Candida in that area. Again, angular cheilitis. So, how do we care for dentures? I mentioned about placing them in a denture cleaner overnight or uh, just in water overnight, but they should be cleaned daily with a toothbrush or an effervescent type of denture cleaner to prevent bacteria from staining the teeth and to remove those food particles. Uh, Toothbrush and toothpaste can also work well, but again, be gentle. Use a soft toothbrush and don't use anything other than a very gentle toothpaste. If you do get diagnosed with Candida, you may consider a very dilute 1 to 10 solution of bleach to water in conjunction with your oral antifungal medication. Therefore, that would help uh, alleviate that Candida. All right, let's talk about some other situations that older adults might uh, encounter, and that would be lichenoid mucositis. It's a white striated erythematous and sometimes erosive lesion of the tongue, your cheek, your gingiva, and often it's due to different medications taken by older adults. Very common medications such as ibuprofen, Aleve, Celebrex, certain diabetes medications, antihypertensives, such as calcium channel blockers and beta blockers, even anti-hyperlipidemia medications such as Lipitor and Crestor, among many, many others. So be aware of that in the oral cavity if you have such areas that we see here. Somewhat of an oral ulceration here on the buccal mucosa, and you'll see these white striations peripheral to that ulcerative area. That's an example of lichenoid mucositis. This is a pretty extensive case here that we see in the oral cavity, kind of an eroded lesion here of the buccal mucosa, some white patchy areas with striations in that area. You can see here what looks like an oral abrasion, an oral erosion. Again, lichenoid mucositis that is medication induced in this case. So, why are we concerned about all this? One of the main things is because older patients are more prone to oral cancers. We can see here we have a significant number of new cases estimated in 2024, and that number is an increasing trend over the years due to the fact that we're getting more human papillomavirus induced pharyngeal cancers. At the same time, we have a slightly rising estimated death rate with oral cancer. So, bottom line, early detection saves lives. The 5 year survival rate for localized disease is 87%, whereas metastatic disease is only 39%. So, early detection is what's necessary in this case in evaluation by your dental health professional. Uh, the problem that we have is that most patients don't seek care when they start to have a lump in their throat, a lesion in the oral cavity, and they delay treatment for 4 to 8 months, which is not a good idea. Sometimes it's due to denial, sometimes it's due to lack of pain, so we want to make sure we educate our patients on the possibility of oral cancer. Your clinician needs to have a high index of suspicion. Therefore, more time may pass if they don't have that index of suspicion before you get a biopsy, and that's not what we want. We want your dental health professional to look at areas of the oral cavity at every single visit to include the lateral portion of the tongue, the floor of the mouth, the posterior oral pharynx in your tonsillar regions, your soft palate, obviously your buccal mucosa, your teeth and gums, areas that are hard to evaluate yourself. White lesions like this are important to note within the oral cavity, especially on the floor of the mouth. You can see here a white lesion on the lateral border of the tongue that may be a precursor to oral cancer. But this area here that has both red and white areas of the buccal mucosa, highly suspicious for oral cancer, and a biopsy is needed in that area, as well as here, this red lesion of the floor of the mouth that crawls up onto the lingual gingiva is important to be evaluated and biopsied by your dental health professional. And of course, this lesion here, the posterior oral cavity in the posterior buccal mucosa, tonsillar pillar region, is important to be evaluated as well. Patients who are chronic sauna lovers, you can see here this patient who may be a gardener, a golfer, a sailor, has a problem on his lower lip that has been biopsied in this case and needs to be evaluated. So if this is what you look like, please see your dental health professional, your oral surgeon, to be evaluated for that as well. Who are high risk patients? Men over 40, who are tobacco and or alcohol users, some patients who are malnourished, immunocompromised, or have other aspects in the oral cavity that lead to chronic irritation. Those patients are definitely high-risk patients. Other established risk factors, persons who have HPV 16 or 18, there are a myriad of HPV viruses, but 16, 18, 21, 23 are ones that we care about systemically for human papillomavirus. Uh, Oral hygiene needs to be good to alleviate oral cancer. Good diet, family history, age, gender, and race definitely are a factor in oral cancer. So, bottom line, genes load the gun, but lifestyle pulls the trigger. So, to wrap it all up, what are good preventable behaviors for good oral health? Obviously, diligent brushing and flossing, use of a fluoride toothpaste. Please limit your sugar intake, whether it be from food products or that of liquid intake, such as sodas and whatnot. Please stop tobacco use, limit your alcohol use, and alleviate dry mouth symptoms. But bottom line, the most important thing is to see your dental health professional for early screening, early detection of problems, and treatment of those problems as well. So I want to thank you for your attention. I hope I've provided some food for thought, maybe some good evaluation, things to ponder, and ask your dental health professional what to look for and for what to you to ask during your dental health visit. So once again, thank you very much for your attention. Goodbye.